So if a man goes to the doctor and the doctor is aware that yes, men do have eating disorders as well. They're not looking at the, because if you look at the diagnostic criteria for anorexia, one of the key symptoms is the loss of period. Of course, you know what I mean. It's still gender bias in that sense, and I think there's a lot of change that needs to be done.
I first of all made an appointment with the nurse, and because I had no idea what to do or anything, so I just spoke to the nurse and kind of said to her what I thought my problem was, and that I had been losing weight, and that I kind of had read this book and thought that that was maybe what I was doing to myself. And then she made another appointment for me to see a specialist GP who was kind of specialised in that. And then I remember meeting her, and she was really lovely, and she so helpful as well. Completely understood and didn't make me feel like I was wasting time or anything, and got me referred straight away, which was fantastic.
Early intervention is the key, because both times, I think the thing that made the difference between time 1 and time 2 for me was that time 2 I was just about able to not fall totally victim to anorexia, because I was able to get into some very good therapy before my weight got too low. I think if people are allowed to kind of pootle along at home without too much help, I think things just spiral out of control. And I mean, the research says that the longer you are at a low weight, the less likely the less good the outcome is. So I think if someone presents to a sort of GP with possible anorexia, it needs to be treated quickly, seriously. Like, even if they're not that underweight, it won't be long before they are, and that's when they're really underweight. That's when it's harder to get back up.
You go into recovery, you regain weight, but you're not better for a while. There's a lot to deal with. I even had a problem with a doctor when the relapse happened. I had to go back to her a couple of times because I was still waiting, and it was really bothering me. But she was like, well, you haven't lost any weight and you look fine. And it was almost as if, she was like, you just need to deal with it. And was quite insensitive about the situation just because I looked fine. And it's like, well, I might look fine, but it doesn't mean I am. I might not be losing weight. So just the fact that, that's a main one, because it almost made me feel like I need to lose weight and then go back to the doctor for her to take me seriously.
I loved that sort of feeling of pain that I got from it. I'd feel like justified to do it, because I guess it's sort of that OCD behaviour coming back, but in a different sort of way. And I'm guessing it really went together, the fact that when I wasn't eating, it was coming out in these sort of strange sort of habits. And but with me, that's how I'd always feel justified to punish myself, because I never felt like I deserved anything. Like, because I said I have like confidence issues and stuff like that, and it felt right to punish myself because I felt worthless, and I felt like because I felt worthless, I should be doing this.
I think I started off because I thought if I ate slower, I'd feel like I was eating more, and I'd feel less hungry, and kind of make it last longer. But then it just became a kind of like, I just felt safe doing it. I just felt like I'd rather do it this way. I don't really want to. This is how I do it, and I'm a creature of habit, and I like doing it this way. And that applied to everything, like the bowls, the forks, like, I don't know, strange.
So it just became your thing that you just did then?
Yeah, and another thing I used to do is I used to hoard food. I didn't used to eat it, I just used to keep it.
in the adult services, they realised what were the things that are important to me that are going to be the big motives for getting better. Like my adult therapist realised that I want to have a really good job, and I want to have a close circle of friends, but like having a baby or like having isn't that important to me. So they've really like honed in on like, okay, you need to get better so you can like survive like internships, and so you can like survive like a long day in the office, or like so that you can like see your friends.
And it's their job as health professionals to try and help people, and it doesn't matter if they think it's not an issue. If the person thinks it is an issue, at least don't laugh at them and be like, no, there's nothing wrong with you, because there's nothing worse for someone's confidence than to laugh at them and tell them that there's nothing wrong. So actually listen to them, because the chances are the patient knows best.